touch on testing. Let's get into hospitalization. So people are testing positive, and then some of those folks are winding up in the hospital. I'm learning that Blacks, Latinos, and Native Americans are being hospitalized at a rate that's 4.5 to 5.5 times that of non-Hispanic whites. I had to double and triple check those numbers, y'all. Aron, first, I'm wondering if you're seeing that playing out in your hospital. And then I'm also concerned, I want to talk about a little bit, where we're, in a world where we're beginning to discuss rationing of care. Some of the numbers are coming down. It's a fluid curve. But when you get into a world where you have to think about how you're going to ration care and make decisions about who gets care and who doesn't, is this a concern? How much of a concern is it really? Among those hospitalized, I want to talk about the percentage that go on to be intubated or have to stay in an ICU. So let's get into that a little bit. Once we get in the hospital, it looks like it's much more serious once we get there.
Yeah, so I was in the ICU previously, and I actually left the position just before everything shut down in March. But just going off of numbers that we know, we do see a lot of minorities in the ICU, a higher percentage. They're sicker patients is what we're seeing. And that has to do in part with comorbidities that happen to be more common, hypertension, diabetes in our communities. And those existed those have been an issue for a while. I entered a leadership position at my hospital as assistant manager, and my unit was actually turned into a designated COVID unit. And so I did see a wide representation of minorities there, Hispanic Americans, African Americans, and usually that had to do with some kind of caregiver relationship, whether someone in a house was sick and then you had to be the caregiver, or you had to take care of the kids, or maybe you work but you also help take care of your grandma or your mother. And so that's usually what you were seeing in there, is usually an older population, and then it's somewhere in that caregiver role.
What about you talk about caregivers? It leads me to think about children. Can you educate us a little bit, either of you, about I'm learning about it, multi-system inflammatory syndrome in children, overrepresented among children of color that are COVID infected. Can you talk about that a little bit? Yet another thing that communities of color have to worry about.
Yeah, I don't really work with the pediatric population, but I did have a patient in his 20s that was actually readmitted after recovering from COVID with the multi-system inflammatory syndrome, which I guess it's considered like MISA because it's in an adult. But yeah, it's pretty much the same kind of pathway as far as the disease progression, the syndrome.
And then in this conversation, when you're talking about this virus, we've got a lot of things to talk about that aren't easy to talk about, frankly. But the Latinx community, the Native American community, particularly men, we're dying at rates that are much higher than our share of the population, 5 times higher for Native Americans, in fact. So some really staggering numbers. Again, is that playing out in hospitals? Are you seeing more mortalities among people of color?
Men specifically, I think it's interesting. I feel like I don't know if I see it specifically in men. I've seen both men and women. On my unit, like I said, we work with lower acuity patients. So oftentimes we do see patients get upgraded to a higher level of care from my unit. But I don't know if it's particularly by gender. I know that the mortalities that I have seen has been in adults transferring into like a comfort care situation. But I can't really point that if it's either particularly men or women, just based on what I see on my unit.
That's what you see here. Well,
I just want to say, I think that one of the things that I noticed in the Hispanic community is that because culturally the men have to go out and continue to work, even if they are not doing well, they are sick, I think that I've seen a great number of males that continue to show up to work so they can provide for their families, even if they have a concern that they might be very sick.
Wow. And we're going to get into that in just a second, Julio, what the mental health aspect impact is of you needing to take care of a family and either having a virus or a social condition that doesn't allow you to do that. We'll get to that in just one second. But let's in general talk about the mental health aspects of all of these numbers. How are Latino families? We've talked about Latino families being more multifamily. We're talking about, people having ill family members who are fighting for their lives by themselves because families can't access them while they're in the hospital. We're talking about overcrowded hospitals. What are all the mental health aspects of all of what we're talking about?
I can say that working as a behavioral health specialist, we have seen an incredible increase in demand for services due to all the anxiety, the depression, and all the side effects that comes from dealing with COVID and the fears and seeing people getting affected, dying. It's just been incredible. I think we have a 225% increase in demand for services for behavioral health.
Wow, 225% increase since the beginning of this thing.
That's correct.
Unbelievable. Unbelievable. Really unbelievable.